What I'd like to speak today is sharing some thoughts with all of you about the art of caregiving. I thought I'd begin with a quote from the former First Lady of the United States, Rosalind Carter. In her book, Helping Yourself, Help Others, Mrs. Carter said, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." I think that encompasses us all. And with this in mind, it's very, very clear that caregiving impacts everyone at some point in their lives. I learned this personally at a very early age. As an 18-year-old eager student just finishing my first year of nursing school at university, I became a caregiver for my beloved grandmother. At that time, she had end-stage colon cancer, and her final wish was to spend her last summer near the ocean where she was at peace, away from hospitals, away from treatments, and away from the chaos of New York City. I was fortunate enough to have a very supportive family who allowed me, at this tender age, who really knew nothing about medicine, to go on this adventure with my grandmother. I learned quickly that becoming a caregiver can be a spiritual and emotional experience, but it also can be a challenging labor of love. Many of the challenges I will mention will be familiar to those of you in this room. From my early experience up to this point in my career, I've come to recognize several very important principles that have helped guide me, both professionally and personally, as a caregiver. I'd like to share those with you now. First, no one can do everything. Finding out a loved one has cancer can be extremely overwhelming. As our speakers have already pointed out, there's anxiety, stress, overwhelming fear, and just chaos. Your whole life is turned upside down. I think we're all familiar with the phrase, "It takes a village to raise a child." Well, it certainly takes a community of caring people to help a patient through the challenges of cancer. Teamwork works wonders. We are so fortunate to live in a place like Toronto with just incredible resources at our beck and call, really. So just as the members of a medical team will consult, help, and support one another, caregivers also need to accept helping hands. Friends and family members often ask, "Is there anything I can do?" because they sincerely want to help, but don't know what is needed. It's helpful for you and your loved one to sit together and make many, many lists. Keep a list of all caregiving tasks, both small and large, and begin to delegate. Allowing friends and family to participate will empower everyone and also enhance your relationships as well as your own sense of well-being. Second, gather information. There's truth in the phrase, "Knowledge is power." Learn as much as you can about the type of cancer your loved one has, including potential health risks, health issues, and information regarding pain management. Additionally, caregivers play a vital role in dealing with medical professionals and often serves as the patient's best advocate. As an oncology clinical nurse, it was a priority for me and my colleagues to always spend a great deal of time teaching patients and families about their treatment, potential side effects, and when it's important to contact your medical team. Establishing a good relationship with that team is really essential in helping your loved one move through the medical system and have successful treatment. Knowledge is empowerment. You can do so much to help your loved one and your family understand how to get through these treatments, radiation, chemotherapy, whatever it is, with positive attitude and confidence. I think remembering that we all work on the same team is essential. We all want the best outcome for our patient. Thirdly, please take care of you as a caregiver. You need to create a healthy balance of your own. Take time every day to do something you enjoy. Dr. Roden, Alexandra, everyone has talked about healthy things that you can do for yourself to enrich and recharge your batteries. It's exhausting to be a caregiver. Do something that you enjoy every single day, even if it's only 10 minutes. Walking, biking, listening to music. The power of music is amazing. Amazing healing happens when you listen to music. Talking with a friend, getting away, and having some private time to re-energize, think through, de-stress. It will avoid burnout, depression, and many of the symptoms that Dr. Roden talked about earlier. It's not unusual for caregivers to develop their own illnesses while using all of their energy to care for a loved one and neglecting their own needs. Simple things such as exercise, healthy diet, eating, and sleeping well will maintain a healthy balance. Finally, take advantage of local support communities. We are so lucky to have so many resources at our fingertips. Places like Wellspring, ELLICSR, and Gilda's Club, of course, offer a tremendous number of programs that will help enrich every aspect of your well-being. There are choices of fun things to do to take your mind off of the stresses that you are dealing with. We are delighted to be able to offer so many enriching programs, and it's been a great pleasure and privilege for me to watch patients heal as they go through their cancer experience and become confident caregivers and members of Gilda's Club. It's been an amazing journey and a great privilege. So I thank you all for allowing me to be here today, and I hope to see you around Gilda's Club, ELLICSR, and Wellspring. Thanks so much.